James Davis.
Thank you, Chair. Thank you, Minister. With regard to access to services for children and young people, we've already touched on the 4-week trials. But in relation to the pre-existing targets, I think of 6 weeks and 18 weeks, what was the performance in achieving those prior to the pandemic?
I don't know. I'll have to write. I don't have those figures at hand.
Broadly, were we going in the right direction?
Progress. Oh, yeah, absolutely. We've been making progress since the long-term plan was first established, and we've been making progress since 2016. And we've been making progress since the Green Paper was announced and initiatives put into place. And I've said this before, we've been working with a treatment gap and a funding gap from successive governments that have never invested in mental health, either in children, young people or in adults. It's been a long-term problem. We've been playing catch-up. And when you're playing catch-up, you're constantly on the front foot and moving forward. So I would say the teams have gone as fast as they can. They have the money's there, but it's getting the services in place, getting the identifying the priorities, meeting the need as well as identifying the priorities, the acute need. The situation we're in right now with eating disorders are an acute need, which kind of blows everything else out the water, because suddenly that's what you have to focus on, the funding, the expertise, the department, the NHS, that's where you have to focus. So, but yes, it's been a forward-moving step since 2016.
And how has the pandemic impacted on the waiting times, as far as you're aware?
So we had an absolute drop in referrals during the pandemic, which is not surprising really. Children went to school, teachers weren't referring. You know, it's interesting because I know the outlook about the pandemic and the impact on mental health is all, if you read the media, is all doom and gloom. When in fact, actually, some people, particularly families, actually reported an improvement in mental health and an improvement in well-being. Some people, surprisingly, enjoyed lockdown with their children for a year. So it wasn't all doom and gloom, and we had an absolute drop in referrals. But what it enabled us to do was to be really inventive about how we deliver mental health services. So I know from my own experience with organisations like Barnardo's and other young people, care leavers that I've spoken to throughout the pandemic, that they were almost demanding the mental health services in future be delivered to them differently. They were using, without phrasing it as such, the pandemic as a catalyst to change things in their favour. So, for example, a group of people I spoke to were saying, you know, we don't want to go and sit in a hospital waiting room. We don't want to go and sit in an access hub and wait to see somebody face to face. I want my mental health services delivered on my phone or by my iPad. Now, that isn't possible for everybody. But what we do know is that for a large number of people, it's actually been really successful. In fact, Tim did some research on this that showed that when you're delivering, and I'm not sure what kind of intervention it was, maybe it was IAPS, when you're delivering digitally to young people, they have less interventions, need less contact, improve quicker. And the reason why is because they can get the help very rapidly. They haven't got to make an appointment, go and travel to an appointment, sit there and wait face to face. They can actually get what they need much quicker. Yeah. And, you know, it also, when you look at the CAMS, you know, I frequently hear, which is not true, that, you know, 140,000 children were turned away from CAMS, which isn't true, because that metric is calculated on 2 visits. But we know that a huge number have 1 visit and have the services that they require, are given the tools that they need, or their parents or their carers are, or their teachers, and therefore don't need the 2 visits. So we have a similar rate of success, you know, at 1-to-1. But we do know that during the pandemic, referrals dropped. They're increasing again, obviously, as people are adjusting back into normal life. And that's what they're finding difficult, the readjustment from lockdown back into normal life. That has put a pressure on us, but we're finding innovative ways to meet those pressures, some of them dictated by young people themselves.
So it's not all bad news, but as of today, are the waiting times going up or down, do you think?
I think they're probably going up with the results of the eating disorders impact that we've had. But also, I know that Claire wants to come in. So I think Claire's probably got the exact figures on this.
It was only to say we can write in with the most up-to-date data, but what we're seeing, broadly speaking, is a pattern of more referrals, more young children and young people coming into treatment than ever before. So we're seeing more than ever before. Yeah. And we do know, for example, with eating disorders, we set the 1 and 4 week access waiting time standard, 1 week for urgent, 4 week for routine. And we know that although we've doubled pretty much the numbers of youngsters coming into treatment, and actually 3 or 4 years ago, we didn't have eating disorder services everywhere by a long shot. So we've come a long way. Before the pandemic, we were meeting those standards, or we were really close to meeting those 1 and 4 week standards. We currently are at 70.5% for 1 week waits and 72% for 4 week waits. But we are seeing phenomenally more children and young people in those services. So what clinicians are doing as referrals come in is making assessments and judgment about how many youngsters can they see, keep safe and intervene with. But we have seen a slight increase in those waiting times in the eating disorder field. But I just wanted to say we can write in with that data for you.
Thank you. Is there a concern that the data is at a national level and therefore if there are local instances of underperformance, they can be hidden?
Well, again, that's over to Claire's team, but I don't think so. You know, I know from the teams that I've met with Claire and the people who look at the care commissioning groups and actually ensure. So, you know, the money that's allocated to care commissioning groups to commission mental health services is ring-fenced. And so I know there is a constant eye kept on care commissioning groups to ensure that that money isn't filtered off or siphoned off into acute services or into somewhere else. So I know that there is a very close watch kept on what local care commissioning groups are doing with the money that they are allocated for mental health spending. And I think that's a really important point, actually, because I'm not sure how many funds are allocated to care commissioning groups, which are ring-fenced for a particular area. And for children and young people's mental health, it was quite important that they got that money. It was spent on children and young people's mental health. So if there are areas where there is a slump, it will be because the care commissioning groups are spending that money somewhere else. And that's something that, you know, we constantly keep an eye on. And occasionally I hear from MPs in all parts of the House who will say to me, you know, I'm not sure that all the money's being spent. And I will flag that up to NHS England and they'll be straight onto it. So we do keep a strong eye on it.
Finally, from me, Chair, GPs are often concerned about rejected referrals to CAMHS. Is that something you keep a close eye on? Absolutely, and it's... So this figure that keeps getting bandied around of 140,000 is actually not true. So, you know, it may be, and I know the Chair's concerned about this because I'm sure I've heard him mention this in the past, it may be that, you know, that we judge on, the metrics are kept on how many young people have 2 appointments at CAMHS, when actually one is suffices with the tools that they need not to have the second appointment. So I think we need to look at how we measure referrals to CAMHS and we need to drill down into the data a bit more in terms of, you know, what children are referred for and what they're presented with. But and I can just add this, Chair, if you don't mind me making this point, one of my concerns is around mental illness, is that because of the emphasis on the terminology and this overarching umbrella of mental health, my concern is that we are seeing young people referred to CAMHS and referred to services when we have Every Mind Matters, and we have Every Mind Matters for children and young people now, when the tools that they need to help themselves, both with their own mental awareness and well-being, are more easily obtained elsewhere so that we can keep the services, mental health services, that we need for those who have serious lifetime mental illness. I think you're right, but I'm specifically referring to instances where there isn't even a first appointment, and I think, yes, there may be alternative services available, but some kind of one-stop shop or joined-up system would often... So we have 60 open access hubs across the UK, but we're using those for a number of things. We're looking at those. I think Peter Vonnegui's given evidence here on those, the Australian model. But they are, you know, the jury's out on those at the moment because we know in Australia they haven't answered the problems that they wanted them to answer. They haven't delivered in the way they hoped that they would. We're looking at them. We have 60 in the UK. We're looking at putting out more. And we're not just using them for mental health services, we're using them for sexual health and other
We're going to talk about that a bit more later, but thank you very much.